So I'm Michael Merz, and I am a hip preservation specialist, fellowship trained in both hip preserving surgeries as well as hip and knee replacement. Hip preservation field is an area that is somewhat new in the field of orthopedic surgery, and some people don't quite understand what the goal of the purpose is. So it's really a threefold aim to reduce hip pain, to increase activity, and really kind of ultimately to help prevent arthritis or degenerative changes within the joint over time. So we do that for really a myriad of different sorts of conditions, particularly things like hip dysplasia, which is shallowness of the hip socket, but also hip impingement, which is on the other end of the spectrum, where it's actually that the bones of the ball and the socket of the hip joint are abutting against each other, which can cause tears to the labrum, which is part of the cartilage, and damage to the cartilage inside the joint that can ultimately lead to arthritis as well. So we do this through several different techniques. Some are more minimally invasive, such as arthroscopy, where you go in through usually 2 or 3 small little poke holes with a camera and an instrument to try to fix the labrum or to try to recontour the bone. And some of these conditions also require open procedures where you have to make more traditional incisions and to correct or reorient the bones of the hip in order to help prevent arthritis and to but more kind of acutely to help make the pain better, as well as to help increase the function. And this can range anywhere from young children even into their early teenage years, and before that all the way up into adults up to their 40s or 50s that are having hip pain that isn't arthritis pain, but they're still kind of at a loss, and sometimes these get diagnosed as being hip sprains or hip strains or early arthritis. Oftentimes these hip conditions can go undiagnosed or missed for months or even years. Some of these specific hip diagnoses are missed for on average of 4 or more years. So if you're having persistent or chronic pain that isn't going away with the hip, I'd be happy to see you and to evaluate as far as both examining you and also x-rays, and even some specific x-rays that often aren't ordered by other providers may be helpful to try to determine what exactly is causing your hip pain.